Hey everyone, I'm Erica Ramos, a doctor of medical science, dermatology physician assistant, CEO of Raven Innovations, and the founder of RestoraScalp. Basically, I eat, sleep, breathe scalp health. My mission is to help you better understand the scalp. Let's break down the science, bust some myths, and most importantly, have some fun while we're doing it. Let's be real, great hair starts at the scalp. You wouldn't build a dream house on a cracked foundation, so why ignore your scalp health when it's the root of gorgeous hair? Many of your clients may deal with flakes, itchiness, and buildup without even realizing it. That's where you, the hair professional, become the hero. You're on the front lines, spotting issues before they spiral. With the right knowledge, you can recommend salon-grade and over-the-counter solutions to keep your client's hair and scalp thriving. And when things go beyond your chair, knowing when to send them to a dermatologist is important because let's face it, healthy hair is sexy and it all starts with the scalp. Your scalp is so much more than skin. It protects, regulates temperature, and houses 80,000 to 120,000 hair follicles working around the clock. Structurally, it's made up of 5 layers. There's skin, a connective tissue layer under the skin, something called aponeurosis, which links all of that to the muscle, the loose areolar tissue, which gives your scalp the ability to move over the bone, and the pericranium, which is the covering on the bone. Hair grows at about a ½ inch per month and cycles through 3 phases. Anagen, which is the growth phase where all the magic happens, catagen phase where the follicles slow down a little bit, and the telogen phase where the shedding occurs, the dreaded shed, the phase that nobody likes. You know, in reality, we lose 50 to 150 hair a day. That's natural. Seborrheic dermatitis, aka your scalp's drama queen, loves to show up uninvited, bringing itchiness, redness, and greasy scaling along for the ride. It can range from a little dryness and fine flakes to thick, yellow, greasy plaques that just won't quit. The culprit? Malassezia yeast, which feeds on oil and dead skin cells, making the scalp its personal playground. Stress, cold weather, and excess oil can crank up the chaos, while summer tends to calm things down. And just when you think it's gone, boom, it's back. To top it off, the inflammation can leave behind either light or dark pigment that can stick around for a little while. While it's chronic and loves a comeback, the right treatments can help keep it in check so your clients can get relief. Let's talk dandruff, the less fiery, more flaky cousin of seborrheic dermatitis. It shows up with the classic white flakes, usually with mild itchiness but without much redness or inflammation. Basically, it's seborrheic dermatitis without the drama. Triggers: the infamous malassezia, which is found on 80 to 90% of adult scalps. Yes, almost everyone has it. Research shows that dandruff affects nearly 50% of the global population at some point. So if your clients have flakes, they're in good company. While not harmful or contagious, it's annoying, and helping them control it with the right treatment will have them singing your praises. Now let's dive into psoriasis. Basically, the overachiever of the scalp conditions, but not in a good way. Psoriasis is a chronic autoimmune disorder where the immune system gets a little too excited and starts attacking the skin. You'll see redness with silvery, scaly plaques. It comes and goes on its own schedule. On darker skin tones, those red plaques might actually look a little bit more violet, pink, or gray. And like most inflammatory conditions, it may leave behind a little temporary pigment. But it's not scarring unless there's serious scratching involved. Oh, and fun fact, psoriasis likes to mingle, so It can actually have an overlap with seborrheic dermatitis in some clients, making things extra tricky. The bottom line, psoriasis is persistent, but with the right care, clients don't have to let it control their confidence. So the take-home points on this slide is that dandruff on the left, you're going to see is non-inflammatory, so we don't really see a whole lot of redness on the scalp. And then we do see that there's loose white flakes kind of just very loosely floating within the hair. Then we will look over to the middle photos where you can see seborrheic dermatitis, definitely much more inflammatory. You can see that redness, that erythema, and you can see those thicker plaques that are, just yellow, greasy scale. So you can kind of see the redness, but also that yellow greasiness that's overlapping it. And then on the far right, you can see psoriasis. You can see the difference between that and seborrheic dermatitis because the flakes, the scale that's overlying psoriasis isn't yellow and greasy. It's more of a white, silvery scale. And so with psoriasis, you're still going to have that redness, that inflammation. And like we talked about in the earlier slides, you're also going to see that in darker skin tones, that redness may actually look like it's violet, pink, or maybe even a little bit gray. And that's just the difference between the Fitzpatrick skin types. But again, you're going to see that inflammation is something that's consistent across seborrheic dermatitis and psoriasis. The difference between the two is how the flakes and the crust and the scale appear. So in seborrheic dermatitis, it's yellow greasy. In psoriasis, it's white silvery. And then again, dandruff, you're not going to see the inflammation, but you're still going to see those white flakes. So many scalp conditions, so little time. Let's talk about just a few more. Let's talk about seborrheic keratosis. Those little harmless growths that are often nicknamed wisdom spots or barnacles. They're common, they're totally benign, and they love to pop up on scalps, faces, and bodies as we age. They can look scaly, waxy, or like they're stuck on, but here's the key. There's no risk of skin cancer, no need to treat them unless they're bothersome. They're just a little sign that your skin's got a lot of stories to tell. Now, that said, we in dermatology, we love that you guys are looking at people's scalps and that you're recognizing when there's something pigmented on the scalp. So don't stop sending them in. If you're worried about a spot, definitely send them to the dermatologist. Folliculitis, basically a bad mood at the base of a hair follicle. It can pop up anywhere you have hair, scalp, face, trunk, you name it. Yes, even those vellus hairs. It shows up with redness, papules, and pustules right at the base of the hair follicle, and if left unchecked, can crust over. The culprits? Bacteria or yeast. And since it's sometimes hard to tell, you can send them into the dermatologist. We'll take care of it. Contact dermatitis loves to show up as angry red patches, often tracking down the neck, the ears, or even the eyelids. Why? Because shampoos, conditioners, and chemicals rinse right over those areas. It can be an irritant reaction, so think of a chemical sitting too long, causing burning, painful sensation, or an allergic reaction, which is a delayed immune response, and those can be super itchy. Either way, you'll usually see well-defined red plaques or patches, sometimes with signs of scratching. Let's clear this up. Scalp ringworm, aka Tinea capitis, is not a worm. It's actually a fungal infection caused by dermatophytes. You'll spot it by its scaly round patches, often with broken hairs, hair loss, and those signature little black dots. Yep, that's the leftover hair stub. Sometimes you might even see papules, pustules, so like little bumps or pustules, and crusting. It's tricky, contagious, and definitely a reason to send clients to their dermatologist for proper fungal treatment. Okay, guys, scalp care is not a quick fix. It's a consistency game. Remind clients that meds and treatments for skin and scalp usually take about 2 to 3 months to show results. There are no overnight miracles here. Recommend medical shampoos with power ingredients like salicylic acid, ketoconazole or zinc pyranthione, and teach them to let their treatment sit longer, 10 to 15 minutes, not a quick rinse. Always suggest lukewarm water and emphasize rinsing thoroughly to prevent buildup and avoid contact dermatitis. And reminder, your scalp is skin. It needs washing. Help clients find the right wash schedule for their hair scalp type. For those who don't wash daily, recommend a leave-on treatment like RestoraScalp to exfoliate, clarify, and control oiliness, and keep that scalp healthy between washes. Finally, if things worsen, like there's really thick plaques, lots of itch, pain, infection, or serious hair loss, get them to a dermatologist ASAP. Healthy hair starts with a healthy scalp.